I have a friend, Robert Joyce. He has MS and sarcoidosis. He couldn't play with his kids after work. He was on numerous medications. He felt awful. And he started low-dose naltrexone. He threw away his cane and he got his life back. And I only interviewed him recently on the show, and it's still the same. He hasn't had to change his dose. This is something I've learned from my radio show after interviewing the doctors, the pharmacists, and the patient, is number one, we all have our own idea as to how to get the best out of LDN. Some people say you have to build up your doses. Some people say, no, you don't. You can go straight for 4.5. Some people say you have to avoid alcohol. Someone says, no, I drink wine every night. Someone says you have to check for underlying infection, candida, and all of that. And others say, no. Right. We have established there are different ways to tweak this and make it better to get the better result, and maybe you have to individualize it, but everybody is absolutely united in the fact that this drug works better than anything out there, and as safely. It truly is safer than aspirin. And once I explain about aspirin, I think you'll know why I'm harping on about that fact. So, given the safety and efficacy of LDN, why on earth did Dr. Gironi's trial not make every single headline? And why did the MS societies all around the world not immediately invest more funds? Absolutely nothing has been done since 2008. And then I did a search for low-dose naltrexone on the Irish MS Society, and it actually comes back with no results found. Now, I personally have contacted so many MS societies and given them as much data that as we have, and it's anything but anecdotal, so there should be something there. I believe that if the MS societies were truly acting in the best interests of people with MS, they would jump at the chance to help us get LDN into the hands of everybody who has MS. They should broadcast on their websites and in their offices to use LDN as a first line of defense based on the information they have, given the safety of the drug, number one, and the potential promise. It truly is, Dr. Skip, a no-brainer. But drug companies make a fortune on MS patients, and I believe the MS societies pump the poison. Now, to keep the LDN movement quiet, they finally gave, now this was after a lot of begging, believe me, a lot of begging went into this, but they finally gave $44,000 to Dr. Ian Zagon's research in Penn State a few years ago. It's only a minute fraction of what he needs, and I believe that they know that. If they were truly concerned about people with MS, LDN would be out there years ago. And people who have died, or are bedridden, or in wheelchairs, or with canes, today would be out running marathons. I really do think I would win if I took them to court, but Noel would never let me. I have enough going on. But I would like their accounting books and sponsor donations to be public information. I think that should be law. And then, after they give out their cookies to the trusting people, if you ask me, the MS advice that you get from the societies is actually deadly. And after the cookies fail, they hand out walkers and wheelchairs and bedpans and convince people who could have been saved that they care. So I want them to stop blocking the truth about LDN and help people with MS, because it truly does work. Low-dose naltrexone is the best treatment out there for multiple sclerosis. So, we're not going to rely on the MS societies. So what can we do to get LDN to the masses? How can we get LDN used as a first line of defense against all diseases based on a disturbed immune system? I know today the focus seems to be MS, but it does work just as well for rheumatoid arthritis, sarcoidosis, the interviews I have had with people have taught me so much about the drug that it's very, very difficult to sleep at night when you know something like this. And actually, what's even more frustrating is that when you do know this and then you go to tell somebody who really needs the information, they're like, yeah, you're nuts, I'm going to take Avonex or Copaxone anyway, because they don't believe me. And then I realize, yeah, well, why should they believe me? I don't want this responsibility anymore. I want us to get together to get this to the masses the right way. So I investigated aspirin. Now, aspirin and LDN have a heck of a lot in common, except aspirin didn't have to crush a billion-dollar industry to get accepted. In fact, I bet you that if aspirin had the competition LDN faces, it probably would not be as widely used today. So think about LDN. I mean, not only MS are we taking on, and Dr. Skip pointed out how expensive those drugs are, but also for rheumatoid arthritis, some cancers. And at this point, before I go on about aspirin, just a little bit of perspective. My mom had breast cancer, and she started taking low-dose naltrexone. And because I saw it worked so well for Noel, I thought, oh, yes, we're home and dry. This is definitely going to work for you, Mom. And there are many stories on the internet about LDN successfully getting rid of breast cancer in some cases, and or successfully keeping it under control for many years. So when my mom was on low-dose naltrexone and her cancer came back and it spread to her bones despite low-dose naltrexone, I think I was more devastated than if I had never heard about low-dose naltrexone in the first place. So we need to also present this with perspective. And that's why I think it's important that we stick to the facts often, because although it is, like I have said many times, the best medical discovery since penicillin, it doesn't work all the time. So it's important that people go in with that mindset. But they also go in with the mindset, well, if it works or it doesn't work, it's not going to do me any harm. And that's why it should be used as a first line of defense. So I think I've lived both sides of the LDN story, where it has really let me down and it has given me my life back. And, LDN is a pain. This whole thing. Aspirin, and I really do wish I had one. Aspirin all started back in 400 BC. This is where everybody goes to sleep. When, in Greece, Hippocrates used to give women willow leaf tea to relieve the pain of childbirth. Now, I'm going to skip a few years and go straight to 1897, when, in Germany, Bayer's Felix Hoffmann developed and patented aspirin, which is the active ingredient in willow and another ingredient to prevent gut irritation. So there's two ingredients in aspirin. Then the first clinical trial for pain relief began, and in 1899, the clinical trials were published as successful, and aspirin was launched. Then, in the 1930s, Bayer's patent on aspirin ran out, and it became a generic drug. In 1974, Professor Elmwood discovered the first evidence of aspirin's effects in preventing heart attacks. 1982, a Nobel Prize was awarded for the discovery of the role of aspirin in inhibiting the production of a natural hormone involved in many body processes, including pain and tissue repair. So, note that aspirin was widely used before we really knew how it worked. And then, in 1989, US researchers reported preliminary studies suggesting that aspirin may delay the onset of senile dementia. 1994, it was shown to help treat preeclampsia in women. 1995, evidence that it protects against bowel cancer. And now today,